Hello class, my name is Elizabeth Giles, and today I will be presenting the article Family Caregiving to Those with Dementia in Rural Alabama. So the aim of this study was to compare and contrast the experiences of African American and white caregivers of dementia patients residing in rural parts of Alabama. This was a cross-sectional study and incorporated a caregiving stress model. And all of the participants used in this study were considered residents of rural areas according to the U.S. Census. So in this study, there was 171 participants, all from the state of Alabama, about half white and half African American. It was 67 African American participants and 74 white participants. The researchers found these participants by random digit telephone dialing, and then they used a cross-sectional telephone survey designed to facilitate interviews with the participants. Caregiving stressors were measured, and they included the number of activities of daily living tasks that needed to be performed, the extent and the stage of dementia of the patient, and measurements of the caregiver's own health. Several different scales and forms were used, and hard copies of all of these evaluations were mailed out to the participants prior to their telephone interviews. Screening instruments used in this study. So the first four evaluations and scales were used for measuring the recipients of the care, and they were basically used to assess the severity of their dementia and the degree of the cognitive deficits that they were suffering from. The last four were to measure the caregiver's health, stress-related symptoms, the use of social and health services, and to assess the caregiver's religiosity. The results for this study were that out of 14 possible activities of daily living, on average about 9.5 were needed by the care recipients. Most of the caregiver stress was from recipients' memory problems. However, the authors also talked about depression and disruptive behavior being a frequent problem as well. About 40% of the caregiving participants rated their own health as fair to poor, and caregivers reported religion as the most frequently used coping mechanism. So some cultural and ethnic caregiving differences were that white caregivers were much more likely to perceive depressive symptoms in their care recipients, and African Americans were less likely to report depressive symptoms. White participants use more medication on average for their own health problems compared to African American participants. African Americans frequented religious services more than their white counterparts, and white caregivers were more likely to use acceptance and humor as coping mechanisms, whereas African Americans were more likely to use religion and denial as coping mechanisms. A couple more cultural and ethnic caregiving differences were the African American participants were found to have less annual income and were less likely to be married than the white participants. African Americans also reported fewer adverse health consequences due to caregiving. White caregivers mainly provided care for their parents, but African American participants were found to be caring for other family members other than their parents or in-laws. White caregivers were found to have higher scores of perceived burden compared to their African American counterparts. A couple of similarities found in this study were that nearly all of the participants used religion as a coping mechanism. Social support scores were found to be about the same for whites and African Americans, and they both rated similar in their health status and quality of life questionnaires. Both groups of participants also reported low levels of formal service utilization. So a couple of limitations I found in this study were that there was a lot of standardized instruments used, such as evaluations and indexes, which is difficult when you are trying to measure something such as caregiving, which is a very complex process. Also, there was a very small sample size, and it was all from the state of Alabama, which is kind of unrepresentative of our society as a whole. And there are very few men caregivers that participated in this study. For future studies, it would be a good idea to try to incorporate a longitudinal study design in order to be able to view the process of caregiving over time. It would be a good idea to use participants living in rural areas all over the United States instead of just focusing on one state. The inclusion of males in future studies would be very important as well, and the involvement of a greater number of participants. Thank you for watching.